Receiving a diagnosis of type 1 diabetes is a life-changing moment. However, with the right treatment and support, individuals can eat normally, continue their usual work, and still participate in all the activities they enjoy. Because the body can no longer produce insulin, treatment focuses on replacing that hormone to manage blood glucose levels. The primary goal is to keep blood sugar as close to normal as possible to delay or prevent long-term complications, such as heart disease, nerve damage, or vision problems. Treatment for type 1 diabetes includes taking insulin, counting carbohydrates, fats, and protein, monitoring blood sugar often, eating healthy foods, and exercising regularly and keeping a healthy weight. Core medical treatments. Insulin is the primary treatment as it is essential for life. It cannot be taken as a pill because stomach enzymes would break it down before it could take effect. There are several delivery options. 1. Injections, a fine needle and syringe or a convenient insulin pen injecting under the skin multiple times a day can be used. 2. Insulin pumps. These are small devices worn outside the body that deliver steady amounts of insulin through a tiny tube or pod under the skin. Pumps are also recommended for children under 12 years old who cannot easily have injections several times a day. Technology in management. Innovations like continuous glucose monitors track your blood sugar levels constantly. Types of insulin. 1. Most individuals use a basal bolus regimen to mimic the function of a healthy pancreas. 2. Rapid-acting insulin begins working within 15 minutes and is typically administered before meals. 3. Short-acting or regular insulin takes about 30 minutes to become active and lasts for 4 to 6 hours. 4. Intermediate-acting insulin, also known as NPH, begins working in 1 to 3 hours and lasts up to 24 hours. 5. Long-acting insulin provides steady background coverage for 14 to 40 hours. Blood sugar monitoring. Monitoring is the only way to ensure blood sugar remains within a safe target range. 1. Finger prick tests are typically performed at least 4 times a day, including before meals and sleep. 2. Continuous glucose monitors, CGM, use a fine needle under the skin to check sugar levels every few minutes, helping to spot trends and prevent hypos. Targets for blood sugar levels. The American Diabetes Association recommends testing blood sugar levels before meals and snacks, before bed, before exercising or driving, and whenever you think you have low blood sugar. General targets before meals are between 80 and 130 milligrams per deciliter. After meal numbers should generally not be higher than 180 milligrams per deciliter 2 hours after eating. Regular HbA1c tests are also necessary to check average blood sugar over the previous 2 to 3 months. Lifestyle and daily management. Daily management involves several key pillars. A. Carbohydrate counting, learning to match the insulin dose to the amount of carbohydrates in food and drink. B. Healthy eating, focusing on nutritious, high-fiber foods like fruits, vegetables, and whole grains, while limiting refined carbohydrates. C. Physical activity, aiming for at least 150 minutes of moderate aerobic exercise a week. Signs of trouble. Low blood sugar, hypoglycemia. Hypoglycemia occurs when someone with diabetes doesn't have enough sugar or glucose in the blood. Symptoms of hypoglycemia: looking pale, pallor, shakiness, dizziness, sweating, hunger or nausea. You can raise your blood sugar quickly by eating or drinking a simple sugar source, such as glucose tablets, hard candy, or fruit juice. In emergencies where a person is unresponsive, a glucagon injection or nasal spray must be used. High blood sugar, hyperglycemia. Symptoms of hyperglycemia: frequent urination, increased thirst, blurred vision. If sugar is over 240 milligrams per deciliter, testing for ketones is required. High ketones can lead to diabetic ketoacidosis, a life-threatening emergency marked by nausea and a fruity breath smell. Other medications. People with type 1 diabetes are also treated for high blood pressure medications, help to keep your kidneys healthy. These medications are recommended for people with diabetes who have blood pressures above 140 by 90 millimeters of mercury. Aspirin. Your provider may recommend you take aspirin daily to protect your heart. Cholesterol-lowering drugs. Cholesterol guidelines are stricter for people with diabetes because of their higher risk of heart disease. Activities of concern. Certain life activities may be of concern for people who have type 1 diabetes. Driving. It's a good idea to check your blood sugar anytime you're getting behind the wheel. Working. You may need additional breaks for blood sugar testing and fast access to food and drink. Being pregnant. The risk of complications during pregnancy is higher for people with type 1 diabetes. See your provider before you get pregnant. Do's. Always carry something with you that will raise your blood glucose quickly, such as sugary drinks, sweets, or glucose tablets. Make sure your family and friends know how to recognize a hypo. Carry medical ID. Lets people know you have type 1 diabetes. Check your blood glucose more often, such as in hot weather or during your period. Check your blood glucose before, during, and after exercise to prevent hypos. Future care. Managing type 1 diabetes is a continuous process that involves finding a delicate balance to support both physical health and mental well-being. Working closely with a specialist diabetes care team ensures a personalized care plan is in place to reach blood sugar targets and prevent complications. While the daily commitment can be demanding, advancements in medicine and technology empower individuals to stay well and live long, healthy lives.